Every therapy we offer at Sedona Wellness Retreat was chosen for the same reason, because it does something specific, evidence-supported, and meaningful for a person who is healing from a life-altering diagnosis. Nothing here is offered because it is trendy or because it sounds impressive. It is offered because it works in ways we can explain, in ways the research supports, and in ways our patients consistently confirm with their own experience. In this video, we are going to walk you through each of our core therapies one by one and explain what it is, how it works in your body, and what the research says, and what you can expect to experience when you receive it. We want you to understand your own care completely. Informed patients heal better. That is not just our philosophy, it is well documented in the research on patient outcomes. Some of these therapies you'll have heard of, others may be entirely new. All of them, when delivered as part of your individualized protocol by our clinically trained team and doctors, are safe, supportive, and designed to work in harmony with each other. Let us begin. We begin with the foundation of our clinical program, intravenous nutrient therapy, delivering healing compounds directly into the bloodstream, bypassing digestion entirely, allows us to achieve therapeutic concentrations that would be impossible through oral supplementation alone. Vitamin C administered intravenously at doses between 25 and 100 grams, many times higher than any oral dose, reaching plasma concentrations that cannot be achieved through any other route. At these concentrations, vitamin C behaves differently than it does as a supplement. It acts as a pro-oxidant, selectively toxic to diseased cells while supporting healthy cells. At high concentrations in an IV, vitamin C generates hydrogen peroxide in the fluid surrounding the diseased cells. Because diseased cells have reduced catalase activity, the enzyme needed to neutralize hydrogen peroxide. They are selectively vulnerable to this oxidative stress while healthy cells remain protected. Simultaneously, high-dose vitamin C supports immune function, collagen synthesis, reduced inflammatory cytokines, and dramatically supports the body through the demands of conventional treatment. Patients typically describe an IV vitamin C session as peaceful and deeply restorative. Many arrive tired and leaving feeling lighter and more energized. Not artificially stimulated, but genuinely restored. Sessions last approximately 60 to 90 minutes. You will be comfortable in a warm cushioned chair, free to read, rest, or simply be quiet. High-dose intravenous vitamin C is one of the most studied integrative oncology interventions available. We administer it at therapeutic doses supervised by licensed physicians as part of your individualized protocol. Research published in institutions including the National Cancer Institute and the University of Kansas has documented its selective toxicity to disease cells and its profound support for immune function. For many of our patients, it becomes one of the most anticipated parts of their day. Next, glutathione intravenous therapy. Glutathione is the body's primary endogenous antioxidant, produced in every cell, present in every tissue, and the central molecule in the body's own detoxification and cellular protective systems. In illness, under oxidative stress, and during conventional cancer treatment, glutathione levels are profoundly depleted. IV glutathione restores these levels directly and rapidly. Administered intravenously, glutathione reaches the cells throughout the body at therapeutic concentrations impossible through oral route. Oral glutathione is largely broken down in the gut before absorption. It neutralizes reactive oxygen species. It supports liver detoxification pathways. It protects healthy cells from oxidative damage caused by chemotherapy and radiation, reduces neuropathy associated with certain chemotherapy agents, and supports the clarity of cognitive function often affected by cancer treatment. Many patients describe glutathione IV as producing a rapid and noticeable sense of mental clarity, a lifting of cognitive fog that often accompanies illness and treatment. Physical energy often improves within the session. The experience is typically gentle and deeply restorative. Sessions are shorter than high-dose vitamin C in approximately 15 to 30 minutes and are often administered alongside other IV therapies. Your body makes glutathione every day. It's your primary internal antioxidant and detoxification molecule, but illness, stress, and demands of cancer treatment deplete it faster than your body can replenish it. IV glutathione restores those levels directly, supporting your liver, protecting your healthy cells, reducing the neurological side effects of certain chemotherapy agents, and lifting the cognitive fog that many patients describe as one of the most debilitating aspects of their experience. Next, curcumin, intravenous IV curcumin, is the primary bioactive compound in turmeric, one of the most studied natural compounds in oncology research, with documented anti-inflammatory, anti-tumor, and immune modulating properties. The challenge with oral curcumin is absorption. Bioavailability is very poor when taken by mouth. IV curcumin bypasses this entirely, delivering therapeutic concentrations directly into the circulation. Curcumin acts through multiple supportive pathways simultaneously. It inhibits nuclear factor kappa light chain enhancer of active B cells, a protein complex that drives chronic inflammation and tumor progression. It promotes apoptosis, the natural programmed cell death that cancer cells resist. It inhibits angiogenesis, the formation of new blood vessels that tumors require to grow. And it demonstrates the synergistic effects of several conventional chemotherapy agents in research settings. IV curcumin is administered slowly, and patients typically describe a warmth moving through the body, pleasant, grounding, and often accompanied by a sense of deep physical ease. Some patients notice reduced joint and body pain during and after the session. Sessions typically run 60 to 90 minutes. And turmeric has been used in Ayurvedic and traditional medicines for over 2,000 years. Modern science has now mapped many of the molecular mechanisms behind its healing properties, and the research on curcumin in other disease contexts is among the most compelling of all integrative oncology. Our IV protocol delivers the therapeutic concentrations that oral supplementation cannot achieve, giving your body access to everything this extraordinary compound has to offer. All right, next, Alpha-Lipoic Acid Intravenous Therapy. Alpha-Lipoic acid is a naturally occurring compound that functions as an antioxidant in both water-soluble and fat-soluble environments, making it one of the most versatile cellular protectants available. It is also a potent regenerator of the antioxidants, including vitamin C, vitamin E, and glutathione, effectively extending and amplifying their activity throughout the body. ALA works at the mitochondrial level, supporting the energy production machinery of every cell. In disease cells context, it demonstrates selective pro-oxidant activity towards these disease cells, similar to high-dose vitamin C, while simultaneously protecting healthy cells. It also crosses the blood-brain barrier, making it especially valuable for patients experiencing neurological symptoms or cognitive effects from conventional treatment. Alpha-Lipoic acid has been extensively studied for its role in reducing chemotherapy-induced peripheral neuropathy. Patients typically describe the alpha-lipoic acid IV as producing a noticeable warmth and a sense of grounding in the body. Energy and mental clarity often improve over the course of the session. Many patients with neuropathy, tingling, numbness, or pain in the hands and feet report significant relief over the course of alpha-lipoic acid treatments. Sessions run typically 45 to 60 minutes. Alpha-lipoic acid is one of the compounds that we are most excited about in integrative oncology because it does so much at once. It protects your healthy cells. It regenerates other antioxidants already in your body, effectively making your vitamin C and glutathione work better and longer. It crosses the blood-brain barrier to protect the neurological function, and it has shown remarkable results in clinical studies on chemotherapy-induced neuropathy, one of the most difficult side effects patients face. We consider it an essential part of almost every protocol we build. Our second category of therapies works through the extraordinary power of heat and oxygen, two of the body's most fundamental healing resources. Disease cells have a well-documented vulnerability to both elevated temperature and elevated oxygen environments. These therapies exploit that vulnerability directly. All right, up next, whole body hyperthermia, which raises the core body temperature to a precise therapeutic range, typically 101 to 104 degrees Fahrenheit. Under close medical supervision, this mimics and amplifies the therapeutic mechanism of fever. one of the body's oldest and most effective immune activating systems. The experience is carefully monitored and controlled throughout. Fever is not a malfunction. It is a precise immune response. Elevated body temperature directly inhibits disease cell replication. Disease cells are significantly more heat sensitive than healthy cells. Activates natural killer cells and T lymphocytes. Increases the production of heat shock proteins that helps the immune system identify and target abnormal cells, and enhances the delivery and efficiency of IV nutrients administered alongside the heat. Hypothermia has studies as both a standalone therapy and as a powerful potentiator of chemotherapy and radiation. Patients receiving whole body hyperthermia are closely monitored throughout the session by clinical staff. The experience is similar to a deep fever, a profound warmth, often followed by a sense of deep rest and release. Most patients feel tired afterwards and sleep well. The session is conducted on a comfortable treatment surface with cold compress available for comfort. Medical staff are present throughout the session, which typically lasts 45 minutes to 90 minutes. The idea that fever heals is as old as medicine itself. Hippocrates documented it more than 2,000 years ago. Modern oncology research has now given us the molecular explanation. Disease cells are significantly more vulnerable to elevated temperature than healthy cells, and fever range hyperthermia activates the immune system in measurable, profound ways. We apply this ancient wisdom with modern precision, monitoring your temperature and vital signs throughout the session to deliver the therapeutic window that produces the greatest benefit. The ozone steam sauna delivers therapeutic ozone, a highly reactive form of oxygen with 3 atoms rather than 2, through the skin while the body is surrounded by warm steam. The skin, the body's largest organ, absorbs the ozone transdermally while the head remains outside the unit, allowing comfortable, safe breathing throughout the session. Ozone in the body acts as a powerful oxidant, creating controlled oxidative stress that triggers a cascade of beneficial responses. Activation of antioxidant enzymes, increased production of cytokines that regulate immune function, direct anti-pathogenic activity, and enhanced cellular oxygen utilization. Combined with the detoxing effect of steam-induced sweating, one of the body's primary elimination pathways, the ozone steam sauna supports both detoxification and immune activation simultaneously. The ozone steam sauna experience is warm, enveloping, and deeply relaxing for most patients. The cabinet surrounds the body in a gentle steam while the ozone is drawn through the skin. Most patients feel the warmth spreading throughout the body over the course of the session, followed by a cleansing sensation that many describe as one of the most refreshing experiences at the retreat. Sessions typically run 20 to 30 minutes. The ozone steam sauna does 2 things at once that are especially valuable in the healing context. It uses your skin, your body's largest organ, as one of the primary detoxification pathways to move toxins out through sweating, while simultaneously delivering therapeutic ozone transdermally to activate your immune system and support cellular oxygen utilization. Many patients tell us it becomes their favorite session of the day. They arrive feeling heavy and leaving feeling clean. Not just physically, but in a way that goes deeper than that. The hyperbaric oxygen chamber delivers 100% pure oxygen at atmospheric pressures above normal, typically 2 to 3 atmospheres, which causes oxygen to dissolve directly into the plasma, lymph, and cerebrospinal fluid at concentrations far beyond what normal breathing can achieve. This hyperoxygenation reaches tissues and cells that are normally oxygen deprived, including areas of compromised circulation around tumors. Disease cells thrive in low oxygen environments. Tumor tissue actively suppresses oxygen delivery to protect itself. Hyperbaric oxygen therapy disrupts this strategy directly, flooding the tumor microenvironment with oxygen and making it significantly less hospitable to disease cells. Simultaneously, the hyperoxygenation powerfully accelerates tissue repair, reduces radiation-induced tissue damage, supports neurological function, and dramatically enhances the effectiveness of oxidative therapy administered alongside it. Inside the hyperbaric chamber, patients breathe pure oxygen through a tube while reclining in the pressurized chamber. The experience is peaceful. Many patients read, listen to music, or sleep during their session. Some feel a mild pressure sensation in the ears during pressurization, similar to an airplane descent, which resolves quickly. Sessions typically last 60 to 90 minutes. Most patients report increased energy and mental clarity following the sessions. Disease cells have a well-known relationship with low oxygen. Tumor cells actively work to keep their environment oxygen poor because that is where they thrive. Hyperbaric oxygen therapy disrupts that strategy directly. By delivering pure oxygen at elevated pressure, we dissolve far more oxygen into your body than normal breathing, reaching tissues and areas that conventional circulation leaves oxygen deprived. It accelerates tissue repair, reduces lingering damage from radiation therapy, supports brain function, and makes cancer's preferred low oxygen environment significantly less hospitable. Many patients tell us they emerge from each session feeling clear and renewed in a way that is unlike any other therapy. Ozone therapy, direct application beyond the ozone steam sauna. Ozone can be administered in multiple direct application forms and localized application to specific areas. Each method delivers therapeutic ozone to specific body compartments with different mechanisms and applications, and is chosen based on the individual patient's protocol and needs. Ozone insufflation, the primary systemic ozone delivery method that delivers oxygen and ozone directly to the rich capillary network of the colon, where it rapidly absorbs and distributes throughout the bloodstream. Effects include powerful immune system activation, direct antipathogenic, antiviral, antibacterial, and antifungal activity, increased red blood cell oxygenation and carrying capacity, and the activation of endogenous antioxidant enzyme systems. The body responds to therapeutic ozone as much as it responds to modern and moderate exercise, with a controlled, beneficial oxidative stress response. Direct ozone therapy methods are typically quick and comfortable. Direct IV therapies, while initially unfamiliar, is painless and takes only 5 to 15 minutes. Most patients are surprised by how straightforward the experience is. The systemic effects, increased energy, immune activation, and reduced inflammation are often noticeable within hours of the session and build with repeated treatments. Ozone therapy has been one of the most extensive research histories of any integrative oncology methodology, with clinical documentation spanning over 150 years and particularly strong evidence based in European medicine. At therapeutic concentrations, ozone is one of the most powerful immune activators and antipathogenic agents available in integrative practices. We administer it using precise, calibrated equipment under physician supervision in the delivery method most appropriate for your individual protocol. The body's response to therapeutic ozone is one of activation, not stress, an immune system that has been given what it needs to do its job. Pulsed electromagnetic field PEMF therapy delivers precisely calibrated electromagnetic pulses to the body, inducing microcurrents at the cellular level that restores cellular membrane potential, the electrical charge that healthy cells maintain and that illness depletes. Think of it as recharging the batteries of every cell in your body. Every cell in the body operates at a specific electric potential, a charge across its membrane that drives nutrient uptake, waste elimination, and cellular function. Illness, stress, and conventional treatment depletes this charge. Pulse therapy induces the microcurrent needed to restore it. The effects are widespread: enhanced ATP production, reduced inflammation, accelerated tissue repair, improved circulation, pain reduction, and in published cancer research, demonstrated influence on cancer cell apoptosis with reduced metastatic potential. Pulse therapy is received lying down comfortably on or within a mat or application system. The electromagnetic pulses are not felt as electricity. Most patients feel a gentle warmth and a gentle relaxation that builds over this session. Many patients describe it as one of the most profoundly restoring experiences at the retreat. Sessions typically run 20 to 40 minutes. Pain reduction is often noticeable during its session itself. Every one of your cells has an electrical charge, a precise waste potential across its membrane that drives everything it does, taking nutrients, expelling waste, communicating with neighboring cells, repairing damage. Illness and conventional treatment deplete that charge. Pulse therapy restores it, using carefully calibrated electromagnetic pulses that induce the microcurrents that change healthy cells back to their optimal potential. It is one of the most researched of all electromagnetic therapies, with documentation across pain management, tissue repair, and patients consistently tell us this is one of the most deeply relaxing and restorative therapies they receive. The BEMER device is a specific pulse electromagnetic system developed and researched specifically for its effects on microcirculation, the circulation within the smallest blood and lymph vessels that supply individual tissues and cells. These microvessels account for the majority of the circulatory system's total length and are responsible for delivering oxygen and nutrients to every cell and removing metabolic waste products. In illness, microcirculation is one of the first systems to be compromised. The BEMER system uses a patented multidimensional signal that has been shown in clinical research to increase the movement and velocity of red blood cells within the microvasculature for up to 30%. The downstream effects of improved microcirculation include enhanced oxygen delivery to oxygen-deprived tissues, including tumor-adjacent tissue, improved lymphatic drainage, accelerated removal of metabolic waste product, reduced local inflammation, and enhanced delivery of IV nutrients to targeted tissues. BEMER therapy is received lying on the BEMER mat for typically 8 to 20 minutes per session. The experience is gentle, and most patients feel a subtle warmth or tingling, a sense of blood moving more freely through the body. Many patients with fatigue report a noticeable improvement in energy levels after just a few sessions. The BEMER is often combined with other therapies to enhance their delivery and efficiency. Blood circulation is life, and within the circulatory system is the smallest vessels, the capillaries, the microvasculature that do most of the work of actually delivering oxygen and nutrients to your cells and carrying waste away. In illness and during conventional treatments, these tiny vessels are often the first to be compromised. The BEMER system restores their function using a patented electromagnetic signal research over more than 20 years that increases microcirculation by up to 30%. The results is that everything else we give your body, the IV nutrients, the oxygen therapies, the food, gets where it needs to go more efficiently. All right, next, the Pyroenergen Therapy. The Pyroenergen is an electrostatic therapy device developed by a Japanese physician, Dr. Muro, who believes that many chronic diseases are associated with the disruption of the body's natural negative electric field. The Pyroenergen uses high voltage, extremely low current electrostatic induction to restore this field, producing a full body bioelectric effect without any current actually passing through the body's tissue. Pyroenergen generates a field of negative electrostatic energy around the patient's entire body. The whole body electrical environment that Dr. Muro documented as producing anti-inflammatory, anti-pathogenic, and immune modulatory effects. The proposed mechanism involves normalization of cellular membrane potential across all tissues simultaneously, reduction of excess positive charge associated with inflammatory and diseased tissue, and activation of the autonomic nervous system towards parasympathetic rest and repair dominance. The Pyroenergen session is one of the most unusual sensory experiences at the retreat, pleasant, warm, and often described as deeply calming. Patients sit or recline on the device platform and feel a gentle warmth and tingling spreading throughout their body. There is no discomfort. Most patients feel deeply relaxed during and after the session. Sessions typically are 30 to 40 minutes. The Pyroenergen comes to us from Japan, where it has been used in clinical practice for over 60 years. Its developer, Dr. Muro, documented its use with thousands of patients over his career. The principle behind it, that the body's natural bioelectric field field is disrupted in illness, and that restoring it supports healing, is consistent with the emerging science of bioelectricity and with much older traditions of energy medicine. We include it in our practice because our patients consistently report profound benefits, and because the growing science of the body's electrical nature is beginning to offer the mechanistic explanation for what clinicians have been observing for decades. Our final category brings together therapies that draw on centuries of human healing wisdom, now understood through the lens of modern immunology and molecular biology. These are some of the oldest and most validated tools in all of medicine. Acupuncture, the insertion of fine, sterile needles to a specific anatomical point along the body's meridian system, is one of the oldest continuously practiced medical systems in human history, with documented uses spanning over 5,000 years across multiple cultures. In the context of integrative oncology, it is among one of the most well-researched of all complementary modalities, with a substantial evidence base for specific applications relevant to chronic disease care. Modern neuroscience has mapped many of the mechanisms through which acupuncture produces its effects. Needle insertion activates macro-nanoreceptors and sensory nerve fibers, triggering the release of endorphins, serotonin, and other neurotransmitters, deactivating pain signaling pathways, reducing cortisol and activating the parasympathetic nervous system, and modulating the hypothalamic pituitary adrenal axis that regulates immune function, stress response, and hormonal balance. In oncology research, acupuncture has demonstrated consistent benefits for chemotherapy-induced nausea, pain, fatigue, anxiety, and hot flashes from hormonal therapy. Acupuncture is typically received lying comfortably on a treatment table. The needles used are very fine, far finer than any medical syringe, and most patients feel little to nothing during insertion. Many describe a dull warmth or a mild radiating sensation at the needle site, what practitioners call the chi. The most common response to an acupuncture session is profound relaxation, often followed by sleep on the table. Sessions run approximately 45 to 60 minutes. Of all the therapies we offer, acupuncture is one with the longest human track record of 5,000 years of continuous clinical use across cultures and continents. And it is also today among the most well-researched complementary therapies in oncology. Sloan Kettering, MD Anderson, and National Cancer Institute have all published research documenting its benefits for chemotherapy-induced nausea and vomiting, cancer-related pain, fatigue, anxiety, and sleep disturbances. Our licensed practitioners tailor each session to your specific needs, supporting your body through whatever aspects of your healing requires the most attention for that day. Okay, mistletoe therapy. Mistletoe extract is the most widely used integrative oncology therapy in Europe, administered to hundreds of thousands of cancer patients annually in Germany, Switzerland, and Australia as part of the standard integrative care. It is derived from the European mistletoe plant Viscum album and contains a complex mixture of biologically active compounds, most notably lectins and viscotoxins, that have demonstrated profound immune modulating effects. Mistletoe's primary clinical mechanisms in oncology care include direct cytotoxic activity against cancer cells through lectin-mediated apoptosis, activation of natural killer cells, macrophages, and helper T cells, increased production of interleukins and tumor necrosis factor, stimulation of the immune system's overall surveillance capacity, and significant improvements in quality of life, energy, and emotional well-being. Administered by subcutaneous injections or IV infusions, it is the subject of over 150 clinical studies and has been the focus of ongoing research at institutions including Johns Hopkins and Sloan Kettering. Mistletoe therapy is administered by subcutaneous injection, a small injection underneath the skin, typically in the abdominal or upper arm area. Most patients feel a slight redness and warmth at the injection site. This local reaction is actually a sign that the immune system is responding appropriately and is considered a positive indicator. IV mistletoe, when appropriate, is administered in the treatment center. Most patients report a significant improvement in energy, mood, and a sense of well-being over the course of mistletoe therapy. Mistletoe therapy may not be well known in the United States, but in Germany, Switzerland, and Austria, it is prescribed by conventional oncologists as part of the standard integrative care. It has over 150 published clinical studies, and it has been studied by Johns Hopkins, Sloan Kettering, and in major European cancer centers. The research documents immune activation, improved quality of life, and direct cytotoxic effects on cancer cells. Our physicians are trained and experienced in mistletoe therapy and prescribe it as part of the individualized protocols where it is clinically appropriate. For many patients, it becomes a cornerstone of their immune support program. You've just heard about the 12 main therapies, and the question I want to answer now is the one I imagine is on your mind. Which of these will you receive, and how will they fit together? Well, the answer is we'll figure it out together, because your protocol, the specific combination of the therapies, the sequence, the dosage, and the timing will be designed based on your history, your current health picture, your conventional treatment plan, your goals, and your body's specific needs. No two patients at this retreat receive the same program. That is not a limitation, that is the point. Every therapy in this video is a tool. Your protocol is the architecture, and the architecture is built entirely around you. What I can tell you with confidence is this: the combination of these therapies, working together, amplifying each other, tailored to your specific situation, creates a therapeutic environment that most of our patients describe as transformative. Not because of any single modality, but because of what happens when the right tools are brought together in the right sequence, in the right environment, for the right person. That person is you, and we are looking forward to building your program.